Hi, welcome to my physiotherapy video site. I'm your host, Brett Wade. The videos contained in this site are for general interest and not meant to replace medical advice or related treatments. Always speak with your family doctor or licensed healthcare practitioner prior to starting any exercise or intervention. Most people are familiar with the rotator cuff muscle group of the shoulder. Rotator cuff tendonitis is one of the most common injuries of the shoulder, and many people have either experienced a rotator cuff tendonitis or know somebody who has experienced one. You have probably seen people, perhaps at the gym, doing external or lateral rotation exercises using cables or bands. Or perhaps you've even been prescribed these exercises by a physiotherapist for your own rotator cuff or shoulder injuries. Have you ever stopped and wondered why you don't see more people doing rotation exercises for the other ball and socket joint, the hip? In this video, I'm going to discuss how similar those two ball and socket joints of both the hip and of course the shoulder, they really are. And I'm also going to try to impress upon you why I think you should be doing more exercises to strengthen the rotator cuff of your hip. The pain of rotator cuff tendonitis of the shoulder is usually caused by a micro tearing where the tendons of one or more of the very small muscles of the shoulder, the intrinsics, insert into the top of the humerus bone. The pain is usually experienced towards the front of the shoulder and tends to be aggravated with activities like putting on clothing or reaching across your body to put on a seatbelt. The reason this injury is so common is that there is a natural imbalance of our very powerful internal rotating muscles for the ball and socket joint versus the two tiny little rotator cuff muscles which externally rotate. So we have this imbalance of very strong internal rotators relative to our weak external rotators. We tend to be incredibly powerful, in fact, in this action of bringing our arms towards each other, much like, for example, hugging or carrying something in front of us. But if you think about it, we're relatively weak in this external rotation kind of action. In addition, we also tend to sit with our arms out in front of us, doing things like working on a computer or sitting a lot. And this position is, in fact, internal rotation as well. So we tend to really stretch out those external rotators at the back of our shoulder, rendering them even weaker. It turns out that the hip, which is a ball and socket joint, much like any other ball and socket joint, like the one in the shoulder, has very similar musculature, very similar anatomy, and of course, similar problems. A tendonitis in the hip can also occur by that same natural muscle imbalance that we see in the shoulder. And it's also affected negatively by sitting too long. As I just mentioned, the shoulder has only two very small muscles which externally or laterally rotate the hip and the shoulder. The hip is very similar. It actually has 6 very small, tiny external rotator muscles. While the 6 muscles to externally rotate the hip may sound like quite a few muscles, these muscles, which are very small, are not very powerful. They don't generate a significant amount of force compared with our much stronger and much more powerful internal rotators, muscles like gluteus medius, gluteus minimus, and tensor fascia lata. They tend to be a lot stronger and overpower those external rotators. Also, iliopsoas, which is a muscle very deep inside, originating on your lumbar spine, inserting into the top of your femur, is also a very strong, powerful muscle. And from sitting too long, this muscle tends to, again, adopt a relatively shortened position. So we tend to have the same arrangement again in the femur as we do the femur and ball and socket joint as we do in the shoulder, where the humerus goes into the glenohumeral or ball and socket joint of the shoulder. Very similar arrangements and very similar problems. Not only do these postural imbalances created by sitting too long affect the muscle length and strength of both the hips and the shoulders, but these sustained sitting postures tend to lead to some challenges or dysfunction in the other parts of the three-dimensional capsule surrounding the ball and socket joints. Through adaptive shortening, tightening of parts of the capsule can happen, particularly tightening of the back of the capsule, both in the shoulders and in the hips, and a stretching out of the front of them. These postural imbalances lead to this, again, joint capsule tightening, which can affect the natural position of which the ball and socket joint, both again of the hip and of the shoulder, tend to rest in. We tend to see now a ball and socket joint, in other words, sitting too far forward in both the hip and the shoulder due to that adaptive shortening at the back of the shoulder capsule and the hip capsule. So the weak lateral rotators or external rotators and the tight posterior hip capsule can be problematic. This, again, as I was saying, affects the normal joint mechanics. The laxity in the front and the tightness in the back and the weak external rotators. Now adding to that some traumatic injuries, whether those injuries are caused by sports injuries or car accidents, or even just repetitive activities like running, can lead to micro tearing of ligaments. It can lead to a tendonitis. It can lead to tearing or inflammation of the joint capsules. So again, similar injuries as we would see with the glenohumeral joint. Other soft tissues which can be affected by, again, this muscle imbalance and this joint capsule tightness are things like bursitis, so you can have a bursitis. We can see labral tears, inflamed tendons. Adding further to these muscle imbalances in the hip is a reflex called the ligamento-muscular reflex, which can get triggered by these repetitive traumas leading to chronic muscle spasms, leading to hypoxia or lack of oxygen to the muscle, causing the muscle itself to not only be weak, but of course painful. And as I was saying, all this gets made worse by people who continue to then do exercises without addressing this muscle imbalance. So sports that involve, again, those repetitive forces like running, causing perhaps the head of the femur to constantly take an anterior or superior position, can continue to irritate some of these soft tissues, further damaging the soft tissues, again, like the ligaments, joint capsule, labrum, but also leading to chronic, more muscular weakness through that ligamento-muscular reflex. The potential solutions to this problem of this posterior tightness and this laxity in the front and weakness, it can be things like injections of prolotherapy or PRP, also changing the postural stresses and beginning to strengthen the hip muscles, especially those hip external rotators. I've found that in many cases, if people assiduously work on strengthening their hip rotators, the pain will improve. If this imbalance and excessive mobility does not get corrected, one way or the other, it eventually leads to potential premature degeneration of the cartilage, the articular cartilage surrounding the hip, both in the socket and on the ball. And of course, that could eventually necessitate a total hip replacement. So let's get into how to strengthen those hip external rotators. We're also going to do internal rotators a little bit and learn how to stabilize the hip joint to treat those nagging hip pains that you might have and prevent you from either getting pain or hopefully delay or prevent you from needing any kind of other procedure, whether that be injections of PRP or Prolo or a total hip replacement. Okay, so this exercise that I'm about to demonstrate is for strengthening your hip external rotators. Obviously, I'm seated in on a stool, or you could be on a chair. I have TheraBand tied around my ankle. There's actually a loop on this TheraBand, and it's tied, in this case, to my treadmill. But you could certainly tie it to a table leg. Just have that TheraBand or resistance tubing, whatever you're using, coming straight out across from you. You could use, again, a band that's doubled up or tie a loop in it. Anything that allows you to get that band around your ankle and then tied again to some stable support base down low. So for this exercise, again, strengthening our external rotators of the hip, those are those 6 really small muscles on the outside of your hip. They're quite deep. They're deep beneath your gluteal muscles. To strengthen them, what you're going to do is first of all get a little bit of tension in the band, as I'm demonstrating here, and then you're going to be crossing that foot across over the other leg so it looks like that. And my starting position is out this direction. I'm just going to put a little more tension on that and then crossing over. It's really important that you don't raise your buttock off the chair, so you're going to keep your sits bones really nice and level and only go as far as your range of motion will allow you. So again, this is strengthening your hip external rotators. You would do 10 repetitions of 3 sets, and as always, making sure that you're not aggravating or increasing any pain. Okay, so I'm now going to show you an exercise to strengthening your hip internal rotators. And right away you might be asking yourself, wait a second, wasn't he just talking about this imbalance with powerful internal rotators overpowering the external rotators as being a problem? And that's true. This exercise done in the seated position actually doesn't bring in those big hip internal rotators like psoas, iliopsoas, gluteus medius, and minimus. Instead, it's actually going to bring in one of the deep 6 lateral rotators, but in this position, it functions as an internal rotator. It's a bit complicated, but suffice to say, this exercise will not contribute to that imbalance. In fact, it will help it a lot. So this is internal rotation. I've switched legs. I'm obviously doing my other leg. And when you want to do both the external and internal rotators for the other side, you naturally would just turn your chair around facing the other way. But let's look at the internal rotators. It looks very much the same as the external rotators, obviously just going in a different direction. So once again, I've got the band tied up down low. I've got a loop around my ankle. And in this case, most people, including myself, have less internal rotation than you do external rotation. So you'll notice that there isn't going to be a lot of motion here, but that's fine. Again, keeping my sits bones or buttocks flat on the stool or chair, and it just simply looks like that. Again, we're not seeing a lot of range of motion. I tend to have fairly limited internal rotation, but I work with what I've got, and I'm strengthening basically one-ish of the deep 6 lateral rotators in this position. And again, a really nice exercise, both for improving your range of motion, but strengthening internal rotators with your hip at 90 degrees. Okay, once again, making sure you're not increasing pain, and you're doing 10 repetitions of 3 sets. You might be asking yourself, what about a stretch for the posterior capsule? With this video at the beginning, we've talked about there's this imbalance between weak muscles that are external rotators primarily, as well as a tight posterior capsule of the hip. And that is, again, the same in the shoulder. So yes, there are stretches for that, and I'll show you a couple of photos of them here. I'm actually not going to demonstrate those, mainly because I have personally found that if you do the strength exercises, working your hip rotation strength, as well as another group of exercises I'm going to show you, that the stretches for the posterior capsule I don't find are as necessary. Plus, they do run a risk, people doing them, of aggravating that hip pain that they may have. So you can look it up if you want, posterior hip capsule stretches. For you, they might be fine. For a lot of my clients, I find just strengthening does the job. No need to do the stretches. However, if you find that your strengthening exercises, after doing them for 6 weeks, you're still finding that pain isn't quite gone away, or you want to improve your mobility a little bit more, you certainly can look up how to stretch your posterior hip capsule. But as I said, I find most of the time, 90% of the time, strengthening does the job. So let me show you now. I mentioned that there's another series of exercises. I call these the 4-position hip exercises. You'll see why in a second. And these ones are done in standing for your hip flexors, extensors, abductors, and adductors. And I do them basically all in one position just by turning myself around 4 directions using that same setup with the TheraBand tied down low and around my ankle. But again, these are done in standing. So let's take a look at those. Okay, so the other part of my hip routine that I do to help with some chronic hip issues that I have had in the past, these exercises, the 2 hip rotators that I've already shown you, and now this 4-position standing exercise, I found to be really helpful. And again, I do these ones in standing. I do these exercises about 3 to 4 times a week, sitting hip rotation, and then the standing 4 position as I'm going to demonstrate to you. So I've got the TheraBand, it's a little hard to see here, but it's tied up just the same way as we did with the hip rotation. I've also got it around my ankle. And I tend to start in hip abduction, but you could do any direction, any of the 4. I'm just hanging on to my treadmill here just for a little bit of balance. I engage my core muscles, both in my trunk as well as in my neck. And as I'm doing that, I'm now going to engage in hip abduction. That's out to the side against resistance. Once again, I would do 10 repetitions of this of 3 sets. But what I tend to do I do the 4 directions as 1 set, and then I take a rest and then do another complete set of those 4 3 times. So here's abduction. For flexion, I just turn myself 90 degrees. I'm going to hang on to something in for balance. So that's for flexion. For extension, well, I'll demonstrate adduction. I would switch legs or turn and face the other way, but obviously I wouldn't be in the camera. You'd see my back. But for adduction, it would be crossing over. And again, I would just have turned 90 degrees from that flexion position. And then if I turn 90 degrees once again, I'll be doing extension. Now I tend to isolate hamstrings when I do this, so I have hip extension with knee flexion, hip extension with knee flexion. So just by pivoting 90 degrees, I've done 4 major muscle groups: hip abductors, hip flexors, hip adductors with the groin, and then hamstrings and gluteus maximus, my hip extensors. So that's my hip routine. I find this works extremely well for treating any rotator cuff issues of the hip. And I think it's really helped me a lot with some of my hip injuries that I've had in the past. If you've seen some of my past videos talking about my hip injury that I had, which prevented me from running the Vancouver Marathon in May of 2023, my bad, just recently, I have now feel like I've solved that problem by doing these exercises, and I'm signed up to do May 2024 Vancouver Marathon. So fingers crossed, this is going to solve that problem. And I hope you've enjoyed this video, and I hope you found some things useful. Perhaps you've got some niggling hip issues, or you want to prevent them. Maybe you're a runner and you want to prevent those hip injuries like I've experienced from coming on. I hope you find this useful. And if you have enjoyed this video, please do give it a thumbs up and consider subscribing to my channel. That's it for now. Thanks very much, and we'll talk to you soon.